Tooth decay is a very common problem. In fact, it's the second most common disease after the common cold. But tooth enamel, teeth are covered with a hard outer mineral coating called the enamel. It's a thin layer that's what we see in the mouth. Tooth enamel is affected by the bacteria that are in the mouth because the mouth's not a sterile place. So the bacteria in the mouth burn sugars from the foods that we eat. The byproduct of that sugar burning by the bacteria is acid. Acid dissolves tooth enamel, which weakens it and eventually causes a cavity. We can reduce the number of bacteria in the mouth. That's where brushing and flossing come in. We can reduce the food source that the bacteria have, so less carbohydrates, less sugars, and also brush it off of there so it isn't sticking around longer. Fluoride strengthens tooth enamel and makes it more resistant to the acids, so that helps on a defensive side of things. Also, saliva is nature's buffer. It neutralizes acids and washes away bacteria and food particles. So we need to stay well hydrated and be able to not have a dry mouth, because people who do have a dry mouth, a disease called xerostomia, have a lot higher decay rate because they've lost the buffering action of the saliva. Fluoride is a naturally occurring compound. It occurs in water all over the world, and it strengthens tooth enamel. It makes it more resistant to the acids that cause tooth decay. So it's a defensive mechanism, and it works both topically if we use fluoride gels or rinses on existing teeth that are in the mouth. It also works systemically if we swallow it because it's in the water supply, and it helps teeth before they form. So as the body's making teeth, the fluoride helps toughen up the tooth enamel, so when the tooth comes in the mouth, it's stronger and more resistant to decay. Public water fluoridation started in Grand Rapids, Michigan in the late 1940s, and the overall effects as far as preventing decay and reducing the risk of decay in especially children and young adults, although the benefits are for a lifetime, but it was so successful that it's considered one of the top public health measures of the last century. When we think about the difference of, my grandparents' generation, most of them, when they, passed away, their teeth were in a glass next to their bed at night because they lost their teeth at some point during their lifetime. Our generation, and definitely generations in the future, are in a position where they can maintain all of their teeth for a lifetime. And public water fluoridation is a huge step towards that. Fluoride in toothpaste is very effective, and it's one of the pieces that we have in our toolbox. What we want to try and do is add a number of things in a number of different ways to get at the results that we want. Fluoride toothpaste, or when selecting a toothpaste, you walk in the drugstore and the aisle of confusion, if you will, there's toothpaste all over everywhere. I always recommend that people look for the ADA seal of acceptance, because that means that the product has been studied by the American Dental Association and its claims have been verified. So, you can feel confident that it's got the dentist seal, that it says what it does and does what it says. And so that should be our first step. If we go to the healthy four, we'll put ourselves in a great place. And the healthy four are: brush twice a day with a fluoride-containing toothpaste, floss once a day or clean between your teeth with a water flosser or something like that, eat a healthy diet, and see your dentist on a regular basis. You do those four, and you're going to be in great shape.